Good morning, good afternoon, good evening. Welcome to the participants and to our speakers today for WHO's webinar. We are in this webinar to launch the second phase of the Science and Policy Snapshot on air quality, energy access and health. My name is Sophie Gumi. I am Technical Officer in the World Health Organization in Geneva in the Department of Environment, Climate Change and Migration, and have the pleasure to chair the meeting today. Maria, can you please share the agenda today? The agenda of today is quite packed. We have a 1-hour webinar. We will ensure we will stick to time. Unfortunately, we do not have translation. We apologize for this. And also to mention that we have received quite a lot of questions during registration of participants, and we will try to ensure to answer maybe not all of them, but at least some of them, the most recurrent one. During the presentations, or we will have also the opportunity to have discussions during the Q&A session. Should you have any question, please write them in the Q&A section, and we will try to answer them. We are also aiming at sharing presentation at the end of this webinar. Now we will start the webinar. We will with opening remarks of Dr. Rudiger Krech, who is a WHO Director of Environment, Climate Change and Migration and Health. Dr. Krech is a German public health expert who currently works as a senior official at the World Health Organization, an advocate for universal health coverage, social determinants of health, health in all policies and social protection. He is a director of the department. Prior to joining WHO HQ, Dr. Krech worked at the German Agency for Internal Cooperation, where he developed and implemented the social protection agenda for Germany's development cooperation, and at the WHO regional offices for Europe in Copenhagen, where he was head of unit for healthy aging. Dr. Krech, you have the floor.
Thank you so much, Sophie, and a very warm welcome to all of you to this important webinar. So this is a webinar which coincides, of course, with the UN International Clean Air Day for Blue Skies that we're going to celebrate on the 7th of September, and something that we have now celebrated for the past 5 years. Colleagues, I think it's so important that science meets policy. So therefore, we have these science and policy summaries in a time when actually lots of evidence is challenged. And we as WHO and our partners that I'm going to recognize in just a second, we believe that science needs to inform policies, that we build policies on science. And that is why these seminars and, of course, the work we're doing is so important. I want to just recognize our scientific advisory group on air pollution and health, and also the Global Air Pollution and Health Technical Advisory Group. These two groups are composed of different researchers, but also civil society, of policymakers, so that we're meeting science, policies, and the requirements that we see in our civil society groups. That is important to actually then drive policies as we do in WHO. Highlighting that air pollution remains and is one of the leading environmental health risks, causing millions of deaths every year, and especially affecting children, older persons, and people living with non-communicable diseases. I just take it that, in some areas we know how health harming certain behaviors are. For instance, if you're smoking or if you're drinking alcohol and so on. But that breathing air can be a risk for so many is by and large not yet fully recognized. And that is, again, why these meetings that we're having here now, they're so important to actually transmit that evidence and this information for people, that it's not just inconvenient, but that it really kills many, many people, millions of lives. So we therefore need to underscore how energy poverty and climate change compound air pollution risks. making this truly a cross-cutting challenge that requires integrated solutions. And so, therefore, we remain committed in WHO to actually provide policymakers with the accessible science-based evidence through these science and policy summaries, and also how we can practically support clean air, clean energy, and climate resilient health systems. Now, looking at the next phase, we're looking at phase 2 of these seminars, and this now is an opportunity to have a deep dive on exposure and the health impacts of air pollution, particularly the burden on end cities and child health, areas that are central to global public health. As we reaffirm that practical solutions exist, we also know that there is no one short, single, and ready-to-go intervention because there are many of those. So we're sharing those, for instance, on household air pollution and related health impacts, exposure to health-damaging air pollutants, understanding the health impacts of sand and dust storms, and green spaces, sectoral solutions for air pollution and health. And mind you, green spaces in cities do not only help us with the quality of air, but they also help us being physically more active and having space to meet each other. So green spaces have multiple positive effects. And so therefore, it's important we're talking to urban planners and architects, for instance, in this space. Now, we do have, of course, vulnerable populations, those who are most exposed and least able to adapt. They must be at the center of policy responses. There is not only equity issues with regards to individuals, but also within countries, as some experience air pollution levels way higher than others, especially in lower and middle income countries. We want to encourage you for open dialogue during the webinar with an emphasis on actionable solutions that can be implemented at country level. So do please share those experiences with us during this seminar. And we, of course, invite ministries of health and agencies and partners to integrate science and policy summaries and the findings of those into their strategies and policies to protect health and advance climate and energy goals. And of course, we want to use the WHO air quality guidelines as a resource to develop or update air quality standards embedded in legislation which protect public health. So these standards, these guidelines that we're producing, they shouldn't be just standing on shelves. They should be used to actually guide the policies that you're making in countries. So let me just conclude by reaffirming our commitment to working with partners worldwide to advance clearer air, sustainable energy access, and a healthier, climate-resistant and resilient future for all. Thank you very much. And with this, back to you, Sophie. Thank you.
Thank you very much, Dr. Kresch, for your welcoming remarks and the great words. We have on the agenda a testimonial from Ms. Lisa Nagon. I am not sure she's online, so my colleagues are looking for it. So I think for the sake of time, maybe we will just go to the next agenda item, which is which is actually my presentation on the introduction for those SPS. So Maria, if you can just go to my slide so that I can just give some introductory slide for this webinar. Yes, okay. So for those of you who were not at the first part of the launch, I will briefly summarize the context and the process for developing those SPS. Next slide. So the Science and Policy Snapshots, they were designed and envisaged as a background documents originally for the second WHO Global Conference on Air Quality, Energy and Health, which took place in March in Cartagena, Colombia. Those are meant to be brief documents, combining scientific and policy information in plain languages. Each SPS can inform intergovernmental discussions, provide really a nice overview on air quality, health, science within different topics that are really a wealth of different topics. It also provides case studies that highlight successes and challenges, as well as evidence-based policy recommendation. The target audience for the science policy summaries are member states, intergovernmental organizations, health community, academia, and civil society. So the topics that are covered in the science and policy summaries. So in July, we release a first set of those briefs, which can be divided into 4 categories. The first one is about exposure and health impact of air pollution in general terms. Second group is about linkages with climate change. They are both common sources of air pollution and climate change, but not only, they are also impacting each other. And that was the idea of tackling those topics, for example, sand and dust storms or wildfire, etc. And a big piece of those SPS is about sectoral policy action to address health effect of air pollution. This is really important because this is really trying to mitigate, to really remove the source. And we have really a lot of different sectoral policy brief on agriculture, transport, open waste burning, but we also cover legislation and transboundary aspects of it. And a final and fourth group is about regional perspectives. So for each WHO region, we will have snapshots that summarize challenges, but also existing progress and processes that are already in place. Next slide. So today we have, as Dr. Krech mentioned, we have new documents available online, and please have a look. For the sake of time, I will not go into the detail, but I really strongly encourage you to download those documents. They are really a great one. Next slide. Okay, in summary, this is a zoom out of the issue on health impact of air pollution. And we really like the slides in WHO because it really illustrates the various entry points for the health sector to act at the different levels. So during today's webinar, as Dr. Krech mentioned, we will hear mostly about exposure and health impact because this is what we would like to stress. This is also where WHO has a strong expertise, and this is our mandate. So we would like to inform the audience about all these different details, and how the health sector has been involved also to tackle this challenge with examples of Iran, Mexico, Brazil, and Colombia. However, it's always important to stress that the most efficient, cost-effective, sustainable, and equitable way to deal with the health impact of air pollution is to prevent emissions at the source, which is what we see on the link side of this slide. And of course, this is a long-term process, and this is what WHO does also in the background. This is what we do on a daily basis, trying really to influence ministries of health to really tackle this at the source. And this is also what about all those sectoral SPSs are about. Next slide. So WHO has developed several tools to support the health sector to engage and interact with other sectors, transport, energy. And this is shown here in the slides, the list of those different tools. Today's release of the SPS on green space, health, exposure, and household air pollution as a pretty good example and are directly linked with the use of those tools to support countries. Next slide. This is just the last one to say that we will have more SPSs to come in the next weeks. Here is a list, so please stay tuned on the WHO website. Next slide. This is my last slide. Again, this is really to thank you all, individuals, institutions, all our expert groups, collaborating centers, institutions, civil societies in official relation with WHO or not, but any other civil societies, and also our UN partners, because we really managed to have this summary, concise evidence thanks to you all. So thank you very much for that. And the final, this is just to thank my colleague, because this is a group effort. And of course, this is next slide, please. This is yes, this is all my colleagues here listed, and thank you very much, because we would not have done that if we were not all together. So thank you so much. I think now we will just, is Lisa arrived? Maria, do you know if Lisa has arrived, or if we just keep Lisa at the end, maybe, for the testimonial? No response?
Yes, Sophie.
Okay.
No, she's not online.
Okay, good. So let's just continue with the next agenda item. So the next agenda item is really a deep dive onto exposure and health impact. I'll give the floor now to two of our key experts who have both been chairing a WHO expert group on air pollution exposure and health impact under the Global Air Pollution and Health Technical Advisory Group. They have been leading the development of those two specific documents, one on health effect, one on exposure, together with the larger group of the experts. I will just give a brief summary of the bio of Dr. Sarana Jovanovic Andersen. So she is a leading environmental epidemiologist at the University of Copenhagen, specializing in the health effect of air pollution, including respiratory and cardiovascular disease, cancer, and mental health disorders. Dr. Anderson is actively involved in translating scientific findings into policy, serving on various advisory committees, including WHO's expert group. And she received the European Respiratory Society Mid-Career Gold Medal in Epidemiology and Environment in 2022. And we also have Dr. Jason West, who is professor and director of graduate studies in the Department of Environment, Science, and Engineering at the University of North Carolina at Chapel Hill. His interdisciplinary research focuses on the intersection of air pollution, climate change, energy, and human health, utilizing atmospheric chemistry and transport models alongside quantitative policy analysis tools. I will now give you the floor to both of you. So Jason and Zorana, over to you.
Great, thank you, and welcome to everyone. I'm really happy to have the opportunity to speak today and to have played a role in helping to write this SPS Science and Policy Summary on exposure to health-damaging air pollutants, and I'm presenting on behalf of the large author team that contributed to this. Next slide, please. Exposure is when polluted air comes in contact with people and people inhale it. In this SPS document, we've tried to discuss the importance of different air pollutants and what happens to them after they're emitted. Many of them undergo chemical reactions to convert primary pollutants into secondary pollutants. So, for example, nitrogen dioxide and volatile organics participate in photochemical reactions that form ozone. Particulate matter can be emitted primarily as a primary pollutant, but particulate matter can also be formed by reactions of sulfur dioxide, nitrogen oxides, volatile organics that form what we would call secondary particulate matter. And the document tries to give a basic understanding of these interrelationships. Next slide, please. One of the main ways that we know about the severity of air pollution in different parts of the world is by measuring it. So reference grade air quality monitoring is important. It is fairly expensive, but it is the state of the art in terms of accuracy of understanding what particulate matter concentrations are or concentrations of other gaseous air pollutants. I show this slide in part to highlight that there is a density of monitors in North America, Europe, and now, as of the last decade, in East Asia, but a lack of monitors in parts of the world that are very highly populated, densely populated, including Latin America, Africa, Southeast Asia, the Middle East. So these are areas where we have large populations, where we have less understanding of what air pollutant concentrations are. Next slide, please. Still, even though we have a lack of monitors, we have other ways of understanding what air pollution is, including low-cost sensors and including satellite instruments. For the case of particulate matter here, scientists have taken those different sources of air pollution, as well as those different sources of information about air pollution, as well as computer models of the global atmosphere to try to understand what concentrations are all around the world. And that's reflected in this figure. So we would have high confidence in our estimates of PM 2.5 here in areas where monitors are dense, but lower confidence in areas like Africa and the Middle East, where there is a lower density of monitors, and therefore we're using other sources of information. Next slide, please. Nonetheless, from these global databases, we can compile information. Here we're showing information about the importance of different sources of air pollution to the PM 2.5 that's observed in these different areas. And we see that different parts of the world have different stories, where in Africa, it's household air pollution because of burning of wood and waste and other things that contribute to ambient air pollution. In the Americas, you see that transport stands out as an important source. If we go to the Western Pacific, which includes China, industry stands out as a different source. There are contributions to air pollution from power plants, from agriculture and waste burning that are common among all world regions. And so if we were to not just look at these regions, but particular cities or megacities that are highly polluted, we would find that each city has its own story to tell about the importance of different sectors and different sources of emissions that are particularly important for that city. This leads us to think that, there's not one solution that would be commonly shared among all cities of the world, but that in each city, we need to have some basic understanding of the sources of pollution that are most important, and let that drive our understanding of what policies would be effective to address that air pollution. Next slide, please. So here were some of the key messages out of this particular SPS document focusing on exposure. We really wanted to highlight that we know enough about air pollution sources, transformation in the atmosphere, transport from place to place, and effects of air pollution to take significant action. So though in some places we're highlighting the uncertainties and things we'd like to know better, that shouldn't slow down action to take to address this important problem that today causes 1 in 8 deaths globally. Some of our recommendations, especially focusing on low and middle income countries around the world, utilize the World Health Organization air quality guidelines. These were rigorously developed, looking at the latest health information. These can form the backdrop, the scientific underpinning for countries to develop their own ambient air quality standards. We recommend focusing on local, regional, and international airshed management. Regional and international is important because air pollution doesn't respect boundaries and can move between boundaries. And so there's a relevance to getting the right governments, local, regional, and international governments together to address common problems. Design policies to reduce emissions at sources. It is the case that some world regions, such as the Western Europe, North America, other parts of the world as well, have successfully reduced their air pollution. And countries that are just starting on this road to cleaner air have a lot to learn, both in terms of the technologies that have been used that have been successful in reducing air pollution, as well as the policy designs. Here, ambient air quality standards have been particularly important, which is why we emphasized considering adopting World Health Organization air quality guidelines. invest in building and managing air quality monitoring and science. So monitoring is one of the first steps toward understanding the severity of the problem and toward identifying what pollution sources are particularly important in a given airshed or city. Starting on this road also requires supporting science, supporting in-country experts that know about the air pollution that are perhaps running these monitors, but also beginning to develop emissions inventories and computer models of the atmosphere. And the international community can help a lot with those efforts. We suggest that you plan to jointly address multiple air pollutants and climate change. So many air pollutants are emitted by the same sources, and those same sources, often in fossil fuel burning, are also the same sources as greenhouse gas emissions. So efforts that would not just address one pollutant, but would think ahead to what are the actions that we need to take to address multiple air pollutants and address greenhouse gas emissions at the same time. Those we expect will have multiple benefits. We think that it's important to quantify the health, economic, and equity benefits of actions so that we have found in countries like the United States that where we've taken the effort to quantify these benefits, that helps to communicate then to the public and to policymakers that there are multiple benefits that come about benefiting health, the economy, and equity. And lastly, support research on health effects of air pollution, in particular, the source-specific burden. So what's the burden of health effects on the population that come from emissions from different source sectors? I'll end there and turn it over to Zorana.
Thank you, Jason, for this very nice introduction and exposure. And I would, if we can switch to next slide, like to thank the organizers for this webinar and also for opportunity to work on this science and policy summaries. So I will present major findings and major messages from the health effects of air pollution, SPS, which is not out yet, but is coming out very soon, I was promised. And also want to thank our large group of colleagues that have worked together over several years to summarize the main key messages on the health effects of air pollution. And I will argue that this is not the most important SPS, but I guess at the source and at the core of this effort to provide more evidence for action globally is that air pollution is a major health risk factor. So I would like today just briefly to summarize what do we know about health effects and stress that we, as Jason mentioned, we know enough about exposure, about sources of air pollution. We also know enough and more than enough about health effects of air pollution. So another good argument to present that we really have enough knowledge both on exposure and health effects to demand action. Next slide, please. So the core of this is this graph. Air pollution, as Jason mentioned, as the newest WHO air quality guideline from a few years ago stated, everybody's exposed to air pollution around the globe. 99% of world population is exposed to air pollution above 5 micrograms of cubic meter of PM2.5. This is established dangerous for our health. So we are dealing with a risk factor that everyone is exposed to. This is one of the key messages and importance for urgent global action. If you compare health impacts of other most important health risk factors, tobacco or physical activity, it's only a portions of populations that are exposed, about 30-35% maybe in a country that smoke or are exposed to passive smoke or so on. But here everyone is exposed. And another key message is this graph that air pollution impacts pretty much all organ systems in our body. And now we have solid evidence on this. And I will just quickly run you through what we know from last few decades of research. And especially research has been developing in the last few years, both from high-income countries that we have originally had most studies from, but more and more we see also research from low-income and middle-income countries that is also highly needed since the sources and levels are quite different, as Jason also illustrated. So briefly, the first line of research and knowledge about health impacts of air pollution came from impact on the lung, since air pollution is primarily inhaled and main exposure comes from inhalation for simply breathing air. Research has looked in the impacts on the lung organs. And we know already now that already from birth or from prenatal exposures, air pollution impacts lung development in small babies and contributing in low birth weight at birth. And throughout exposure in childhood, air pollution hampers ideal development of the lung, and that underdeveloped lung function in children leads to increased risk of asthma in children and increased risk of asthma throughout entire life as exposure continues for all of us throughout lifetime, and increased risk of chronic obstructive pulmonary disease in later in life. And as well, we know now enough about air pollution impact on lung cancer. EARC has published a report already in 2013 summarizing evidence on carcinogenicity of PM and diesel and a number of other pollutants with highest level of evidence that air pollution is carcinogenic to humans and with evidence at that time enough on causal links with lung cancer. We know now, especially since COVID and even before, more and more studies have also been interested in impact on and respiratory lung disease, infectious respiratory lung diseases. So now we also know that air pollution impacts our immune system already from birth, and in small children, constant exposure to particles kind of triggers our immune response. And that contributes for higher risk of infection from bacteria and viruses and higher risk of pneumonia. And this is now very well established both in children and grown-ups, and even studies with COVID show very clear links. So when it comes to lung, we have strong evidence now both on impact on chronic lung diseases throughout lifetime, but also infectious lung diseases. From lung, the smallest of the particles can cross blood-lung barrier and come into our circulatory system in our blood vessels. And knowledge now and research in the last few decades has shown that air pollution, similar to tobacco smoke, can impact our blood vessels negatively and cause formation of atherosclerotic diseases and increased risk of serious of blood pressure, endothelial dysfunction, increased blood coagulation, deep venous thrombosis. All key of all of these impacts is inflammation, both on lung and heart and other organs. And this directly leads to increased risk of most serious cardiovascular diseases such as myocardial infarction, stroke, and more evidence is coming out now with links with heart failure, arrhythmia, both incidence of these diseases, but also linked to mortality from these diseases, which is #1 cause of mortality globally. From heart, we also have now evidence on impact on metabolic diseases, which are closely linked to cardiovascular diseases. And we have now established evidence in link of air pollution with type 2 diabetes and increasing evidence of type 1 diabetes. On function of the liver and kidney, chronic kidney diseases, evidence is also growing. And something that's very up in time now is more and more evidence coming on brain impacts beyond stroke that we knew for a number of decades now. Research in the last just decade has already established very strong links between air pollution, increased risk of advanced cognitive decline in elderly that leads to increased risk of dementia, as well as neurological development in children. And we see more and more studies and impact on cognitive development in children and poor cognitive performance in school, IQ, and so on, as well as impacts of mental health. Neuroinflammation in the brain also impacts our emotional well-being, and more studies now show clear links with depression, anxiety, both in children, adolescents, and elderly. And this we'll see more research on for sure soon. And just I cannot cover all diseases covered, but also another very important impact is on reproductive health, on pregnancy, both in mothers and children, risk of infertility, and so on. Just to briefly mention all of these important impacts. Next slide, please. because of the fact that everybody is exposed to air pollution, and that air pollution, as you've seen now, we have enough evidence, is pretty much linked to all major diseases. We see this leads to these large numbers. 1 in 8 deaths, or about 6.4 million deaths globally, are assigned to air pollution. This means that air pollution is one of the leading environmental health risk factor, actually now the second leading health risk factor for disease globally. Close to 84% of all air pollution-related diseases are non-communicable diseases, as I mentioned, including ischemic heart disease, chronic obstructive pulmonary disease, and lung cancer. So burden on NCDs is huge, and air pollution prevention should be one of the key priorities for prevention of NCDs, as it is really one of the top risk factors for all of these. And as I mentioned, everybody is exposed, but not everybody is affected equally. And we have to prioritize care and information campaigns and prevention strategies in those that are most impacted. And these are children who are under development and often more exposed, being more outside, being more active, and so on. Pregnant women, elderly, people living with chronic diseases that are already have compromised lungs or cardiovascular systems, or suffering from diabetes or dementia, as well as those that are in the lowest socioeconomic groups, who are usually more exposed, living closer to busy roads, industrial sites, waste dumps, and so on, and have less access to information and good care. Air pollution burden remains still underestimating and is likely to increase. We still have not fully mapped the burden. We have more and more research on mental health, lung cancer sites other than lung. We have strong increasing research now on breast cancer, stomach cancers, and other sites, psychiatric diseases, and so on, not to mention many others. Next slide. Another very important point and a strong call for urban urgent action globally are substantial inequalities, both in exposure, as you've seen from Jason's slides, but also in air pollution impacts. And clean air actions would increase equality and better health for all, especially those that are most affected and most disadvantaged. Ensuring health data is a key part also in increasing both evidence on air pollution in those areas where we have none still. We still need local studies in areas where we lack air pollution measurements, where we lack good health data. So we still better reporting, monitoring, and investments in research to get better estimates of the local impact and to drive local actions around the globe. And just to summarize, this SPS and open for discussion that we have enormous health evidence at hand. There is no question about it. We have enough evidence to act, and this evidence really call for actions. At the heart of air pollution actions, health must be priority, and we have to act now to ensure clean air for all, and speed up actions for those who are most vulnerable. Cleaner air will result in less people being sick from non-communicable diseases and major infectious diseases, as well as improve health of many of those chronic patients that live with chronic diseases worldwide. And with this, I will end, and thank you for your attention. And from both me and Jason, and we have provided our emails if you, beyond the seminar, webinar, want to reach out for any clarifications or questions. Thank you. Turn over to you, Sophie.
Thank you very much, Sorana and Jason. This was amazing, and thank you for all your efforts in leading those exercises. We are a bit running out of time, but we now have Lisa joining us. So I would like to invite Lisa to provide a testimonial. So Lisa is the ambassador of the Association for the Promotion of Youth Leadership, Advocacy, and Volunteerism, and a second-year medical student at the Catholic University of Cameroon, Bamenda. She is actively engaged in youth leadership and advocacy on air pollution and health, informed by her personal experience living with asthma. Lisa, the floor is yours.
Hello, everyone. My name is Nagon Lisa. I am 19 years old from Cameroon, and I live with asthma. I am here to share my personal story about how air pollution has shaped my life and why I believe that clean air should be recognized as a basic human right. So starting with the second slide, next slide. I was diagnosed with asthma when I was only 6 months old. I decided to share this picture with you all to see how young I was when I had my first asthma attack. From the very beginning of my life, I grew up with inhalers, medication, doctor visit, and hospitalization. One of my earliest memories is having my first asthma attack when I was just 5 years old. I was running with my siblings, we're playing, laughing, when the air around us was filled with fumes from nearby automobile repair shop. Suddenly, I felt like someone was sitting on my chest. I collapsed, gasping for air, and was rushed to the hospital. I remember the fear in my mother's face when she saw me struggle for my breath. That moment was terrifying, but sadly, was only the beginning. Next slide, please. This slide just shows that in my community, air pollution is everywhere, from the burning of waste to cooking with firewood to smoke from vehicles and deforestation. My daily activities were this daily exposure became triggers for my asthma. I experienced frequent coughing, wheezing, and shortness of breath. My life revolved around avoiding attacks rather than enjoying the simple things that many children take for granted. Next slide, please. But there was a turning point. At 16 years old, I became the Clean Air and Climate Health Ambassador. I began speaking to students and policymakers about the dangers of air pollution, not only for people like me, but for the entire community. Next slide, please. Yes, this slide just shows that at Happy Life, we do the Day of Clean Air, in which we advocate for clean air as a basic human right for all the children. Around the same time, my family and I moved to a new area surrounded by trees and fresh air. For the first time, I experienced what was like to breathe easily. My health improved, and so did my hope for my future. Next slide, please. That's why I'm proud to have contributed for the Global Asthma Report 2025, not just to tell my story, but to remind decision-makers that real people are living with this crisis. Clean air is not a privilege, it's a right worth defending. Next slide, please. Yes, this is where I shared my asthma report 2025, and my story was published. So our decision makers should see that we people are going through this crisis. And moving on to the next slide. And today I am a first-year medical student. My experience has given me the passion to study medicine, and so I should become a pediatrics or chest medicine, depending on the opportunity that comes up. I strongly believe that medical curricula should include air pollution and environmental health so that future doctors can better recognize, prevent, and manage these challenges. Next slide, please. Sorry for rushing because we're running out of time soon. So move on to the next slide. But my story is not just about me. Millions of children around the world are growing up in environments where the air they breathe is silently damaging their lungs, their heart, and their future. Air pollution is not just an environmental problem, it's a health crisis. It is also a question of equity and justice, because the most vulnerable, including the children, are the ones who suffer the most. Next slide, please. So my message today is simple. Clean air is a basic human right. We need stronger policies to reduce air pollution, shift to cleaner sources of energy, and protect the health of future generations. I refuse to leave asthma or air pollution define my life. I am determined to keep fighting, not just for myself, but for all the children everywhere who deserve to breathe clean and healthy air. Next slide. Thank you very much. This is my email and number in case you need anything. Thank you.
Thank you very much, Lisa. This is amazing, and I think your story is extremely moving. And I think there is nothing that can replace personal stories. It's much more powerful to make people realize and to maybe leverage action than just statistics. So thank you very much, and congratulations for all your efforts. And I hope you will succeed and have a lot of impact. So thank you so much. This is really testimony. Okay, now we will switch to we have heard the experts, we have heard Lisa with her story, and now we would like to switch to country examples, and especially from the health sector. We welcome 3 speakers. We have Dr. Guchani, who is the head of Air, Health and Climate at the Change Office in the Ministry of Health and Medical Education in Iran. We have Dr. Asanvan, who is an expert in one of our expert group from Tehran University of Medical Science. And we also have Dr. Riojas, who is director of the Environment and Health Department at the National Institute of Public Health of Mexico. And basically what we would like here, they all have some slides to share with you, because we had some questions for them, how the health sector can address air pollution, can act on air pollution, energy, poverty, and climate risks, and also practical interventions and policy successes. So I will give the floor, Maria, if I'm not wrong, we have moved Horacio first. Is that correct, Maria?
I think so. It's Heather who is sharing the presentation,
Okay,
but
no.
I think it's the Iran.
Maybe not,
Yeah,
maybe
it's
not,
Iran.
maybe not. Then it's Sadegh. Yes, Sadegh, I'll give the floor to you.
Hello, everyone. Can you hear me?
Very well.
Good afternoon, everyone. I'm Sadegh at School of Public Health, Tehran University of Medical Sciences, along with my colleague, Dr. Guchani from Ministry of Health. I will be presenting on air quality, health impacts, and implemented measures in Iran. Next slide, please. Here is the outline of my presentation. First, I will begin the brief introduction of Iran, followed by a discussion of air pollution and its effects. And then finally, I highlight the implemented measures in Iran, especially for sand and dust storm. Next slide, please. As you may know, Iran is a population with about 90 million people, and the Clean Air Act in Iran was approved in 2070 and communicated to various organizations and institutions for implementing. Under this law, the Department of Environment is responsible for supervising its enforcement. Also, the Department of Environment is responsible for monitoring and reporting the air quality in Iran. Also, Ministry of Health is responsible for preparing air quality guidelines and announcing emergency situations. Next slide, please. Currently, in our country, we have about 315 air quality monitoring stations across the country that measure and monitoring criteria air pollutants, as well as black carbon in some stations. And the most extensive monitoring is in Tehran, the capital of Iran, with about 40 air quality monitoring stations, where real-time data is available for all, and national websites. These platforms make air quality information accessible to policymakers, researchers, and general public, which is crucial for transparency and effective decision making. Next slide, please. Here you can see the spatial variation of PM2.5 as the main air pollutant, just rest of the world. As you can see, the annual mean population weighted for PM2.5 in Iran is about 30 microgram per cubic meters, which is 6 times higher than the WHO air quality guidelines. And as you can see, the west and the east of the country are exposed to high level of PM2.5 that originated mainly from sand and dust storms. In some days, the PM2.5 concentrations daily in the west and east of Iran reaches about 1,500 microgram per cubic meters, and it shows that that we have a complex sources of air pollution in Iran. Next slide, please. And this slide, you can see the temporal variations of PM2.5 across the country. As you can see in all years, the annual mean of PM2.5 in Iran was much higher than the national ambient air quality standards in Iran. That is the same as the US EPA, and is above the air quality guidelines by WHO. As you can see in this trend, an important point is in this trend is that from the beginning up to 2018, the concentration of PM2.5 nearly decreasing pattern. However, after that, after this year, I mean 2018, an increasing trend in PM2.5 concentrations have been observed. To be honest, this period coincide with the intensification of international sanction and difficult economic situation in Iran. That many air pollution control plans fall in our country. Next slide, please. Ambient air pollution in Iran is account about 10 to 12% of all-cause mortality, and every year about 5,000 attributable deaths caused by ambient air pollution. That this affects can cause to economic losses about $12 billion. Nearly 4% of national GDP, and unfortunately 7% of pollution-related deaths occur in children under 5, and on the average air pollution in Iran reduce life expectancy by 1.3 years in Iran. Next slide, please. Here you can see the comparing anthropogenic and human and non-anthropogenic sources of air pollution across the EMRO countries. As you can see, in these regions, not only anthropogenic sources, but also the non-anthropogenic sources like sand and dust storm contribute contribute to air pollutions, and these complex, I mean anthropogenic and non-anthropogenic, significantly contribute to elevated level of particulate matters, and this dual burden makes air quality management in Iran more complex. Since it involves not only industrial and traffic emission, but also natural desert and sandstorm event. It's the same as the sources that Jason showed. And next slide, please. In this slide, you can see the result of systematic review of source apportionment in the EMRO countries have shown the relative contribution of different sources of PM2.5 concentration. This evidence is critical for prioritizing interventions and guiding regional cooperations on pollution control. As you can see in this, nearly in all countries, the dust has a main sources for the PM2.5 and PM10 in our regions, and that is a need to, we have a regional cooperation to control these sources. Next slide, please. The Ministry of Health has taken significant steps to mitigate the health impacts of sand and dust storm. That here you can see some of them, and some of them are developing and distribution guidelines on face mask usage and self-care practices. Also conducting widespread public education campaigns through universities, healthcare centers, schools, media, and face-to-face sessions. Also disseminating printed materials. So the goal has been to empower people with practical knowledge to reduce their exposure and protect their health. Next slide, please. Another important steps have been done by Ministry of Health is the provision and distribution of standard face mask, particularly to personnel in affected area. In addition, more than 290 hospitals and healthcare centers have been equipped with the portable air purifiers that to protect healthcare personnel in the area that are exposed to sand and dust storm. Next slide, please. On the monitoring side, also that you can see in this slide, the Ministry of Health has about 53 air quality monitoring stations in dust affected and underserved regions. And in this slide, as you can see, we have translated global WHO global air quality guidelines to Persian to improve accessibility and developed an advocacy plan for a stronger air pollution control policies. These initiatives reflect a shift from purely reactive measures toward a more preventive and strategic approaches. And to conclude, air pollution in Iran remains a critical challenge with severe consequences for public health and economy and environment. However, important steps have been taken to monitor, manage, and reduce its impact. Much remains to be done, but the progress so far provide a foundation for stronger actions in future. Thank you very much for this opportunity. Sophia, floor is yours.
Thank you very much, Sadek. This is impressive what Iran has done, and I know also that in Iran you have been using the software tool to calculate the health impact of air pollution and AirQ Plus, and you have done you have trained a lot of students and a lot of officials and scientists, right? So this is a very nice collaboration, and that you were able to really use this tool to develop a lot of those things. So this is great to hear.
My pleasure.
We now hear about Dr. Horacio Riojas Rodriguez. Horacio, he's also the director of a WHO Collaborating Center in Mexico, in Cuernavaca. And Horacio, the floor is yours.
Thank you. I don't know if you have my presentation there. Well, first,
should.
thank you. Yeah, thank you very much for the invitation, Sophia, and all the team. It's a pleasure for me to be here to share some our experiences here in Mexico and in the region of Latin America regarding the advances on some policies and interventions related to air pollution. I don't know if you have my presentation, or do you want me to present it?
If you have it, yes, go ahead. If you have it at hand, you go ahead. Maybe this is, we have some issues with IT, and apologize in advance. We have some major issues in WHO at the moment.
Okay, can you see?
Yes, we can.
Okay, so what I will present from our country and from our region is some works that we have done related with the strength capacities in the health sector, some regulatory updates in our region, and what we have advanced related with monitoring and surveillance systems in some cities here in our region. I want to say that from the last meeting in Cartagena, in Colombia, in the region, this issue has updated in the public health agenda in all the countries. So it has been a very important meeting there, and it was very useful for our region to have it here in Colombia. Well, regarding the overview of the update of Latin American regulation, here are some examples of what different countries are doing regarding to updating the national regulation using the WHO air quality guidelines. At least these four countries are now working in updating the national standards. The most good one is in Mexico, which is very close to the WHO guidelines. We will have an update of this regulation next year. We are updating this regulation every 5 years, and we are following the WHO guidelines. And in the other countries, they are using the intermediate guidelines to adjust the national regulation. And this is important because we think that if we can go on updating this regulation, all the other interventions on air pollution can also advance in other sectors like energy, economics, and others. So we see this updating just as part of the more comprehensive air quality management in our cities. So we are working a lot of this in the regulation. We also are updating our air quality indexes in the countries, in each one of these 4 or 5 countries. In Mexico, we have a new air quality index that are using this method of NAUCAS, which is more precise regarding risk communication related with air pollution, especially with PM 2.5 and ozone. So we are doing a strong effort to update the air quality indices in different countries. In Colombia, for example, they are just updating the index that they are using in Bogota, and in other countries are working in the same way. So this is also important in terms of the risk communication related with air pollution. We have other problems like in Brazil, where they have a lot of problems with the forest fires during the last years. It was a very huge years related with this, and they developed this tool regarding the surveillance system regarding with air pollution, and they also perform an exercise of burden of disease related with forest fires. They have this very important event in the Amazon region, that is very important for them and is very important for all the continent. And it has been a very huge problem, these forest fires. And they have developed this environmental health surveillance system using satellite data and also health data to inform the population and to prevent the effects of the forest fires. So this is an example of what we are doing related with environmental surveillance systems. In Mexico City, we have also developing an environmental health surveillance system using the local monitors and linked them with medical units. We created what we call the Sentinel units, that is formed by a air monitor and 1 or 2 clinics, and we are putting together that in a one platform that you can see in these slides. We created these endemic corridors. We adapt these methods for having daily data on air pollution and different diseases, especially respiratory diseases. So we are creating this environmental health surveillance system that is working already in Mexico City, and now we are expanding that in 2 other cities in Mexico. At least 11 cities are working now in this new environmental health surveillance system putting together the data of air quality and some health effects daily. We have worked a lot on training in Mexico and in the region. This is a part of the effort that our collaborating center and the Pan American Health Organization is doing in the region. We have this workshop in Barranquilla during the last year, and we are creating a network of specialists in the Latin American and Caribbean cities. We have this network in which we participate as technical advisory, and we have already training and capacitate more than 50 persons in this network using the RQ Plus tool, and this tool has been applied in the cities to perform the burden of disease, and this has been using in the local air quality management plan in each one of the cities. We have more than 50 cities that are already working with RQ Plus, and they are putting together with the policies, local policies and local air quality management in the region. So it is an example of what we are doing with the health sector, and other sector, especially the environmental sector, are participating in these training sessions. In fact, we have built this RQ Plus virtual course that is already in the PAHO virtual page, and this have launched during the meeting in Colombia, and now many people from other regions are taking this RQ Plus virtual course, and we think that it will be a very strong tool to expand the air quality assessment and the mortality and morbidity evaluation, and that will be using into the policies, into the national and local policies. So we have worked a lot on this part of capacity building for the health and the environmental sector using this RQ Plus tool. Finally, I want to mention that we are working together with other sectors in different issues related with energy, especially indoor air pollution, trying to get cleaner energy at home. We have this problem in almost all the region, and different countries are working in national plans for having clean energy together with the energy and economic sector. So this is an example of we are trying to work together with other sectors, and also we are working on climate change in Mexico and other countries. We are participating in the new NDCs that will be presented in the COP30 in Brazil, and we are trying to include health indicators in the climate change agenda, and trying to link there the agenda of climate change and air pollution. And finally, we are trying to include air quality management programs in each one of the countries. We are trying to include the health chapter in the air quality management programs, in the national and local management program, to include specific goals to reduce the effects, especially on mortality, but also in morbidity, in these national and local plans. So these are three examples on how we are trying to put together the agenda of health, energy, and air pollution in national and regional policies. And I think that's all for me. This is my email, and thank you again for the invitation, Sophie. Thank you very much.
Thank you very much, Horacio. This is really amazing what all the progress that have been conducted in Latin America, and yes, I think what you have managed to do in the region is really critical and important, and it's really a nice lesson for other regions who could really work together to establish that kind of activity. So congratulations, this is really a wonderful work, and yeah, wonderful example. So thank you both, Horacio. I think for the sake of time, we are a bit out of time, and I apologize for this. I think I don't know if there are key burning questions that would be needed to address. What we will try to do, we will try to compile the question and share with participants some of the answer. For the one that are recurrent, we have tried to answer the question in the Q&A, and you have had access to the email of the participants. So if you have any question, please don't hesitate to reach out to them. We will make it available, the presentations on the website. Now I will maybe give the floor to my unit head, Dr. Heather Adder-Rohani, who is the unit head for the Air Quality and Health Unit, and for the closing remarks and thanks the participants. Yes.
Wonderful. Thank you, Sophie, and thank you to all the great speakers. I do realize that we're way behind time, so I will make this very short. Just to highlight the great things we heard, we was set first by Dr. Kresh with a nice opening about how air pollution and tackling these upstream determinants and this health and all policies approach is really an important way and the important role of the health sector. We heard a lot from Dr. West and Dr. Anderson about exposure, those pollutants, as well as those health effects and how it really impacts the body systemically. And it really leads to a number of diseases, and epidemiology is showing more and more each day. We heard from Dr. Nagan around about her very impressive work in Cameroon to really raise awareness and advocacy, and how it was her living with asthma has really impacted her life, and how as a youth advocate and a future health professional, she's really trying to champion. We heard from Dr. Hazvan in Iran about the important work that they're doing to tackle air pollution, some of the guidance they're giving specifically around face masks, use of air quality indexes, looking at anthropogenic sources and those specific around sand and desert dust, which is a really key topic for some areas of the world. And finally, we heard from Dr. Horacio about some of the great work that's going on in the Pan-American Health Organization region, which is basically the Latin American region, a lot of the activities ongoing in Mexico and Brazil and other places. So it was really a packed webinar, but as you can see, there is so much action happening on the ground around air quality, and it really is a collective problem for collective action that we're all moving towards and working together. So please stay tuned. There are more webinars coming up in the series, and we are looking in and want to hear your voices, want to hear your feedback to knowing what would be some things that you would like to hear more about, and what can we really help you answer the questions. So please act to commit. We have the Clean Air commitments open until September 7th on Clean Air Day. So we're really trying to recruit a bunch of different advocacy and agencies to really achieve and commit to this target we're setting forward with other across the UN system, across the world, of cutting air pollution health impacts by 50% from anthropogenic air pollution sources by 2040. This is something we know we can all do, but we all need to work together. So please try to commit. We have the link in the chat here. So hope to see you on the next webinar soon, and thank you all.
Thank you very much.
And thanks to all to our speakers, and so much. To her, Rojas, Hasavan, Dr. Sama, and Dr. Anderson. Thank you so much.